Hi, everyone. Welcome back to another episode of the SHECP Alumni Spotlights. As always, my name is Jenny Lee, and I did my SHECP internship in 2016 at LIFT DC. I'm excited to catch up with Klaudia Wojciechowska, a SHECP alumna who recently started med school with a background in public health. Thank you, Klaudia, for chatting with me today.
Hi, Jenny. Thanks for having me here. And that was perfect pronunciation. So thanks for that.
Thank you. To start off, I want to ask you, so why did you decide to become involved in the Shepherd program at Middlebury?
Yes, thanks for the question. So I want to sort of back up a little bit, Jenny, and just say that I also interned in 2016. So we were in the same cohort. And I interned in North Carolina, in Greensboro, North Carolina, at the Cone Health Center for Infectious Disease. So it was basically an outpatient clinic that treated lots of folks with different infectious disease issues, but predominantly those with HIV and hepatitis C. And so very outpatient, clinic-centered, patient-centered internship. And the reason I decided to do the internship was sort of twofold. So one, I knew that I was interested in medicine. I actually started medical school a few weeks ago. And so I knew that I wanted an internship that was clinically focused. And I knew that the Shepherd internship had several placements across the country that were clinically focused. And so that was one of the reasons, and kind of aligned with what I wanted to do. And then the second reason was more personal. So I grew up low income in New York City. I'm an immigrant, and I attended Middlebury College, which is a pretty wealthy, elitist, higher ed institution. And I felt like the school really struggled to have conversations about poverty and wealth. And I think the Shepherd internship was one of the few ways that the school was, in fact, meaningfully engaging in these conversations and this work. So I was personally drawn to that. And I think it also reflected an experience that I wasn't having at Middlebury. And so that's why I decided to join the Shepherd internship.
Yeah, that's wonderful. As an alumna of Washington and Lee University, I can definitely relate to your experience and just like that the Shepherd program really, brings a lot of richness to the campus. So when you went and you did your internship in infectious disease, what did you take away most? It could be either from like the internship itself or like that specific one, or just being involved with the Shepherd internship in general.
Yeah, so I think hindsight is 2020. I think when I finished the internship, I didn't realize how meaningful it would be and how much it would end up shaping my career path. So I knew that I wanted to go into medicine. And so obviously I did a clinical internship. I learned so much about infectious disease, and it strengthened my pursuit of wanting to do medicine. But in some ways, it also derailed me from medicine in a really awesome way. So I took 4 years off between undergrad and medical school, and I worked in public health. And the reason I decided to do public health was because one of the reasons was because of the Shepherd internship. And so when we were at the clinic, I think one of the biggest takeaways was just the frustrations that I would see that the physicians were experiencing every day, that were coming from issues at the public policy level, the health policy level. So issues that the physicians had really little control over, but they would trickle down and impact the everyday care that the physicians were providing to their patients. And so, for example, we had a lot of uninsured patients because North Carolina does not offer Medicaid to really anyone except pregnant women and children, and then folks who are above a certain age or have disabilities. So there's a huge group of people that if they're low income and don't have private insurance, they're left uninsured. So if they would come into our clinic and they were HIV positive, we could get them medications covered through the federal Ryan White Act, which provides HIV care to those who are HIV positive. But if they had any other co-ailments or comorbidities, right? So diabetes, high blood pressure, high cholesterol, there's nothing that we can do for them, right? So they had their HIV taken care of and cared for and monitored, but none of their other health issues, right? And like people don't have their health issues divided, right? Like people come like as their whole self and expect care for all of the things that they're suffering from. And the physicians were really frustrated at that, right? And there's so little that they could do. And so they were only treating this one thing, knowing that not treating the other issues that the patients were facing was impacting also their HIV care. And so I think I walked away not wanting to do medicine initially and actually wanting to do bigger picture, bigger bird's eye view things. And that's why I moved into public health. And I was already sort of interested in public health, and that internship was like, yeah, you definitely need to do bigger picture stuff. And so after the internship, I was entering my 4th year in Middlebury. And so I just packed it with public health courses. And after graduating, I worked at the CDC and then the Indiana Department of Health for 4 years, and then sort of came back to medicine. But yeah, so it was kind of like a, yeah.
Yeah, sorry. I love that you're able to use it to affect your, not only what you did after graduation, but like immediately like change like what you were gonna spend your final year of studying on. So that's really awesome. I think with, you know, the pandemic, for better or for worse, a lot of people are more aware of public health issues. And I think it has like sparked interest in people who maybe didn't have an interest in med school or public health before. So I was wondering if you had any advice to current Shepherd students who were interested in medicine or public health, if you have any advice for them.
And Jenny, that's such a good point. I was thinking about this recently, just thinking about like what the pandemic is going to mean for public health and medicine, whether that means more funding or a backlash and less funding in public health. And I think there's going to be increased probably enrollments in medical school and public health school. And I've already seen it when I was applying to medical school. It had the highest number of applicants in a really, really long time, or maybe if ever. So lots of people were applying to medical school. And I think the pandemic had a lot to do with it. And I think what I would say to people that it's a long journey, whether it's public health or medical school, it's difficult. It's not, especially public health, not glamorous. You're really overworked, underpaid, but it's also really gratifying work, right? And like people who do public health don't do it because it's glamorous. They do it because they care, because they believe in health equity, right? Because they believe in social justice. Like there's a lot of folks that really have kind of a sense of, again, health equity and social justice, and that's why they go into fields like public health and medicine. And I think you need to have those in order to be able to have resilience and to be able to have careers in those, right? Because if you don't have something really strong and personal that drives you, you're going to get burned out, especially when you are working in a field that has so much public attention to it, right? And like people, there's so many people that have all types of opinions on it. And so you just really have to have something that drives you to be able to kind of have a career in this over, you know, the next few decades.
Yeah, that's such a great point, especially like before the pandemic. I wouldn't have really thought so much about that public interest factor, right?
Yeah.
Absolutely. Well, thank you so much, Klaudia. It was really great to catch up with you. And thank you all for watching this episode of the SHEP Alumni Spotlights. If you're an alum who's interested in participating, please reach out to Danielle. All right. Thank you. Have a good day.
Thanks, Jenny. Bye.